Ashley was 18 when she was diagnosed with Ewing sarcoma. That was her first cancer. It was a week before her senior prom. And she went through 10 months of chemotherapy. About 3 months after she ended her chemo for Ewing's, we found out she had leukemia, which was caused from the chemo.
I was devastated. I knew what to expect. I knew my chances weren't good because I had had cancer before. I didn't really know what to think. I was devastated.
The news was amazing when I found out that she survived her first cancer, but after finding out that she had leukemia from her first cancer, it was heartbreaking. It's more likely that she could have died with this cancer.
It didn't make any difference how reassuring the doctors were. You always question what the future was going to bring you. It was scary.
With the second cancer, I felt a lot worse because I had gone through so much chemo before and I had to go through more of it, and then the bone marrow transplant makes you feel, I can't even explain it, like it just makes you feel like nothing, like you just have no energy to walk. I had to do physical therapy just to get me out of my bed.
Ashley went through quite a bit physically, as most leukemia patients do. The steroids bloat you, give you hair on your face, make you very moody, irritable. She went through some mouth sores, she had rashes, she had all kinds of physical things go on. Your skin gets real dry. And I think for her, being 19, it was a little tougher. We're very conscious of our appearance.
There were a lot of side effects from the transplant. I turned yellow because I had yellow jaundice. I got puffy because of the medicines. I was taking like 40 pills in the morning and 40 pills at night just to prevent certain things.
It takes probably 6 months to a year before you feel great. And what's really difficult is it could be 3-4 months after the transplant and you feel like, okay, enough already. Why do I not feel fantastic? Why do I still have hair this short? Why do I have to take all these medications? And you have to trust us that it will get better. But it probably will be a year before you're off all the medications. Your hair will grow out enough that you feel okay, and your face won't look so different.
I think it's extremely important for teenagers to ask questions because it's their body. And when you're a teenager, you know your body. And especially being sick, you know, every fever, anything.
We were very involved at the hospital, asking questions, standing over, what are you giving her? Why does she need that? That will make her throw up and that won't. And telling them the little nuances of Ashley. And they need to know what you know about your child. And they need to listen to what you know about your child. I think for teenagers and older children going through this, they know what they're missing. Ashley knew her friends were out having fun, doing what 18 and 19-year-olds do. And that hurt. She talked to her friends and they'd say, oh, we're getting ready to go to this party, and she knew she couldn't go.
I was mad. I was mad. I wasn't mad at anybody in particular. I was just mad at the world.
Ashley did want to give up. And we were all there behind her saying, you can't. You've gone too far. You've fought too hard. You've got too much to live for. You can't give up.
There were a couple times when nurses would have to come in and give me a pep talk because I said, I just don't want to do this anymore. I just don't want to do this. I just want to be at home with my family. I don't want to be in the hospital. And they had to sit there and say, you know, you know, of course it's your choice, but it's either this or not being here. And there were a couple times when I just said it's not worth it to me. And thank goodness I had my family and my friends to be there and, you know, push me along and say, come on, you got to do it.
The entire process was like a roller coaster. It's got its ups, its downs, rights, lefts, surprises, and I don't like roller coasters. I don't like roller coasters. I don't ever care to ride one again. We never talked to Ashley about making a living will that I can recall. We never did anything like that. In hindsight, we probably should have.
I didn't have a living will. There was one point that me and my mom were just kind of nonchalantly talking, and, you know, it was kind of understood. I just, you know, nothing in particular, this goes to this person or anything like that. There was one day, I remember me and my mom, I sat there and I said, if it comes down to it, I want a Lynyrd Skynyrd song at my funeral. And like, to this day, she can't listen to that song. I try not to worry about death. I try to take everything one day at a time. And I'm in no hurry to do anything. This has not in any way made me scared to do anything. You know, me and my mom are gonna go skydiving. I'm not scared to do stuff like that at all. If anything, it's made me wanna live each day, you know, like I was dying.
Brittany's a real good kid. She's very soft-hearted. She's just opposite of Ashley. Ashley has dominated Brittany ever since they were little. She's pretty much taught Brittany everything she knows. Brittany would have been totally lost without her sister. She was lost. She was angry. She was more angry than probably anybody. We couldn't give her the support that we wanted to.
When Ashley first got sick, I was about 17, and I was still in high school at the time. School's very stressful, but even more having a sister that actually goes to school with you and might be dying, it's horrible. My parents didn't have a lot of time for me when Ashley first got cancer. I felt very left out when my parents visited Ashley all the time because, you know, it felt like she was the only daughter at the time, but I know that if she didn't make it, then I would be the only daughter, and I didn't want that.
Given a second chance, I would do a lot of things different. My advice to other parents who are going through this and have a child of a younger age is to rally friends and relatives around them to support them, because they need as much of attention as the child in the hospital does.
You can't clone yourself, obviously. Our family helped tremendously. We asked, when you send Ashley things, send Brittany things, whether it's just a card, ask about Brittany, talk to her, make sure that she knows that you care as much about her as Ashley, which all of our family did. I think it's important to find something that you can look forward to. Ashley looked forward to Dallas, our dog, coming and seeing her. She looked forward to hearing it bark on the phone. Ashley and I would always go shopping before her chemos, and it would just take our mind off of things. We would have fun. She is a shopaholic. We would look at things, we would window shop, we would dream about when she got into her apartment, how she would decorate it. It was a release. Shopping was a release because it was normalcy. It It was normal, although she would shop without a hat and she would have no hair and people would look at us, and I always said, you know what, Ashley, you're showing the world that cancer patients live.
I try to lead a healthy life in general. You know, I'm 21. If I was at a bar and somebody was smoking next to me, for a while there I would freak out, and my nurses said, you cannot let this run your life. You know, yes, it has in the past, but you have to live a normal life and not let stuff like that ruin your, you know, your being. And I think that's really important, because you just do things that normal people try to stay healthy by not smoking, by eating healthy, you know, exercise. I just try to be normal. I had to take 2 years off in between high school and college. Before I started college, I could not wait. I was so excited. Can't wait to start school and be normal again and, you know, do what my friends get to do, because all my friends were away at school while I was sick, and that was hard.
One of the first times we knew that life was back to what we would say maybe normal pre-cancer, Terry and I were in the kitchen and we heard Ashley and Brittany fighting, and we just smiled and hugged and said, they're back to being sisters again, they're kids.
I worry about my health every day of my life. I am constantly worried that I'm gonna relapse. That's my biggest fear. Everything reminds me of relapse, and I try my hardest to keep my mind off of it. But then you get a phone call and somebody that you had your transplant with has relapsed. And I've gotten 3 of those calls in the past month. And so that kind of thing really hits hard. I get my blood drawn often. I have a regular checkup every 3 months, and that includes like a CT scan, just different stuff like that. But I just think it's important to stay on the track that they want you to, not just say, hey, I had my transplant, I'm done with cancer, I'm fine.
Following what your doctor says about the long-term follow-up is very important. There are medical issues years past a transplant, and you'll be followed by your transplant center. And what's important is that you follow with your doctor. Even if you move away and you get new doctors, they need to know that you had a transplant.
Because of the chemo and radiation, I cannot have kids physically. That's not going to stop me from having a family. I'm going to adopt kids from different countries. It's just not an option not to have kids. I've always wanted kids. My financial situation, I do worry about getting insurance in the future. I was really lucky while I was sick. My parents both had really good insurance plans, but we ended up having to get Medicaid because insurance stops at $1 million, I believe it is. And you have these little pills that you take that are $300 a pill. That adds up quickly. When I, am in the real world, they're gonna look at my health history and say, we can't insure her, she's too high of a risk. And then what am I gonna do? It's just, the financial aspect of it is just unnecessary stress, but what are you gonna do?
The future holds for the girls. They can be anything they want. They can do anything they want. I think we've all learned that we're not going to be here forever. And we better grab everything we can while we've got the time to do it.
Ashley's got the world in front of her. The future holds everything. I truly think she appreciates every day.
Life after transplant is different than before, and it's often a lot better. You don't have the disease that brought you to transplant, And what's really remarkable is a lot of people say that they've grown up and blossomed through the transplant process.
Life going forward after Ashley's cancers is going to be great because she's alive and she has changed so much from this. She's a survivor, so she's not scared anymore.
Life after transplant is just a roller coaster in general. Some days I get really depressed, some days I'll watch a movie or hear a song that reminds me of being in the hospital or being sick, and it makes me sad. But I've changed so much as a person now because of it. I'm not happy I had it, but I'm happy of who I've become from it. You know, it's just, like it's a part of me now. Like it's made who I am now. Because if I never had cancer, not even once but twice, I wouldn't be who I am. And I think everything happens for a reason.